I want to speak directly to someone today. Not to everyone watching, to one specific person. You may be sitting with a Medicare decision in front of you that feels too complicated to make confidently. Or, you may have already made it, and something you read recently made you wonder whether you got it right. Or, and this is the person I am thinking about most as I sit down to record this, you or someone you love has recently received a diagnosis. And somewhere in the back of your mind, behind everything else you are carrying right now, there is a quiet, frightening question about what the medical bills are going to look like. I want to talk about that today. Not with a whiteboard and a formula. Just clearly, honestly, in plain English, with real numbers from a real family's experience. Because this is the decision that matters most when everything else is already hard enough. I'm Anderson. What I have is 5 years of sitting across from people at the moments when these decisions were not theoretical, when a diagnosis had already arrived, when the bills were already coming, when the question of which Medicare plan they had chosen had moved from a planning exercise to a financial reality. This channel exists to give you the information you need before those moments, so that when they come, the answer is already in place. Subscribe and hit the bell, because these rules change every year and you deserve to know what those changes mean for you. Now let me walk you through what I consider the most important Medicare comparison I have ever seen. A family, I will tell you more about them at the end of this video, faced $709,440 in medical bills over 10 months as their mother battled cancer. That number is not hypothetical. It is not an estimate. It is the actual total charged across 10 months of hospital stays, chemotherapy treatments, and outpatient care for a 70-year-old woman on Medicare. I want to walk you through exactly what each of the 3 Medicare options would have meant for that family's out-of-pocket costs. And I want to start with the option that most people default to when they do not fully understand what they are choosing. Option 1 is original Medicare only, Part A and Part B, with no additional coverage. There are people who choose this path deliberately because they do not want to pay monthly premiums for a supplement or an Advantage plan, or because they philosophically prefer not to involve private insurance companies in their healthcare. I respect that position, but I want to make sure you understand what it means in a situation like this one. Of the $709,440 billed, Medicare negotiated the total down, as it always does, to approximately $375,000 as its approved amount. Medicare Part A paid its portion of the hospital stays. Medicare Part B, which covers outpatient care including chemotherapy, paid 80% of the remaining approved costs. The remaining 20% of $375,000 in Part B approved costs is the patient's responsibility. That 20%, with no cap and no ceiling, came to approximately $75,000 owed out of pocket, plus the Part A deductibles from 2 separate hospital stays, which reset because they were more than 60 days apart, adding another $3,200, plus the Part B annual deductible of $226. The total out-of-pocket under original Medicare only, on this $709,000 bill, approximately $80,500. That is real money. That is a number that changes people's lives. And the reason it can reach that level is the one feature of original Medicare that most people do not understand until it is too late. There is no maximum. There is no cap. The 20% co-insurance on Part B continues indefinitely, regardless of how high the bills go. Option 2 is original Medicare plus a supplement plan, specifically Plan G, which is the most comprehensive Medigap plan currently available to new enrollees. A supplement plan is a private insurance policy that fills in the gaps original Medicare leaves behind. Plan G covers the Part A deductible, the Part B co-insurance after the annual deductible, and most other cost-sharing requirements that original Medicare does not pay. The monthly premium for a Plan G policy for a 70-year-old woman, using a realistic average for her area, was approximately $165 a month. Over the 10 months, plus a partial year covered in this example, that came to roughly $2,000 in premiums paid to have the plan. Here is what Plan G actually did with that $709,000 bill. It covered both Part A deductibles, $3,200 total. It covered 100% of the Part B coinsurance after the annual deductible, which was the $75,000 exposure that original Medicare alone would have left unpaid. The family's total out-of-pocket under this option, $4,225. The $226 Part B annual deductible, the $2,000 in supplement plan premiums, and nothing else. On a $709,000 bill, $4,225. Option 3 is Medicare Advantage. These are private plans that replace original Medicare entirely, approved by Medicare but administered by private insurers. They are often available for little or no monthly premium, which is one of their primary attractions. They cover the same services as Medicare, but may have different networks, different cost-sharing structures, and different rules about where and from whom you can receive care. The defining feature of Medicare Advantage for our purposes today is the maximum out-of-pocket limit. By law, every Medicare Advantage plan must cap what you pay in a given calendar year. Once you reach that cap, which varies by plan but typically ranges from $3,000 to $8,000, the plan covers 100% of remaining approved costs for the rest of that year. Using a plan with a $5,000 maximum out-of-pocket as our example, this family would have hit that cap early in the year, before many of the hospital stays even occurred. Their total out-of-pocket for 2023 would have been $5,000. Then the calendar reset on January 1st, 2024, and a small additional amount, approximately $1,150 was incurred before the end of the treatment. Total out-of-pocket under Medicare Advantage, $8,050, including the $2,000 in Part B premiums that everyone on Medicare pays, regardless of which plan they choose. That is significantly better than original Medicare alone, but it is approximately twice what the supplement plan cost. Now I want to give you the 4 factors that actually determine which of these options is the right choice for you, not for the family in this example, for you specifically, because the numbers I just walked you through are not an argument that everyone should choose a supplement plan. They are an illustration of what the difference looks like under a specific set of circumstances, and your circumstances may be meaningfully different. The first factor is your health history and your realistic sense of your health trajectory. If you are in excellent health at 65 and have no chronic conditions and no family history of serious illness, a Medicare Advantage plan with a reasonable maximum out-of-pocket provides protection against catastrophic costs while keeping your monthly premiums low. If you have a known condition, if you are managing something that requires regular specialist care or ongoing treatment, or if your family history gives you reason to anticipate significant medical needs, the predictability of a supplement plan's near-zero out-of-pocket costs may be worth the higher monthly premium. The second factor is where you live and what your local healthcare network looks like. Supplement plans allow you to see any doctor or use any facility that accepts Medicare, anywhere in the country. Medicare Advantage plans have networks, and not every provider or hospital participates in every network. If you live in a rural area, if you travel frequently, or if you have established relationships with specific physicians or medical centers that matter deeply to you, the network flexibility of a supplement plan has real value that does not show up in a premium comparison. The third factor is your prescription drug situation. Supplement plans do not cover prescription drugs. If you choose a supplement plan, you will need to purchase a separate Part D drug plan, which has its own monthly premium, deductible, and co-pays. Most Medicare Advantage plans include drug coverage, dental, vision, and hearing benefits bundled together. For someone with significant prescription drug costs, or who values the simplicity of a single plan covering all these needs, Advantage plans offer real convenience. The fourth factor is your financial situation and your relationship with uncertainty. A supplement plan costs more per month but delivers near certainty. Your out-of-pocket is predictable and capped at a very low level. A Medicare Advantage plan costs less per month, but asks you to absorb risk up to your maximum out-of-pocket limit each year. If a $5,000 to $8,000 annual out-of-pocket is manageable in your budget, if you can absorb that without serious financial stress, Advantage plans are genuinely good coverage at a genuinely lower regular cost. If that level of annual uncertainty would cause you significant stress or financial difficulty, the supplement plan's predictability may be worth every dollar of the additional premium. The family in this example, the mother who faced $709,000 in cancer bills over 10 months, had a Medicare Supplement Plan. She had battled cancer once before, 28 years earlier. She understood her health history. She had a relationship with an oncologist spanning decades. She needed the freedom to go to any facility, to choose her own doctors without worrying about network restrictions, and to face the financial side of her illness without her family having to navigate billing disputes or coverage denials on top of everything else they were carrying. Her plan meant that on $709,000 in total bills, her family's total out-of-pocket was $4,225. They never had to wonder which hospital to take her to. They never had to deal with a single coverage dispute. They could focus entirely on her care and on their time together. That is what the right Medicare plan looks like when it works. Not a number on a comparison chart. A family that did not have to fight on two fronts at once. If you are currently on Medicare and you are not certain whether your plan would protect you the way hers did, or if someone you love is approaching 65 and has not yet made this decision, I hope today's video gave you the information to have that conversation clearly and without fear. In the next video, we are going to talk about the Medicare enrollment decision itself, specifically whether you even need to take Medicare at 65 or whether you have more flexibility than you think. Share this video with someone who is navigating a Medicare decision right now. This is the comparison that makes the abstract feel real. Subscribe if you haven't, hit the bell, and I will see you in the next one.